My name is Hannah Crandall, and I'm going to be discussing the effects of COVID-19 pandemic on leadership in nursing. So this poster, as I said, is going to explain how the COVID-19 pandemic affected nursing leadership. And it's important to note here that leaders in nursing have a vital role in ensuring patient care outcomes and supporting the nursing staff. These leaders are the people who make sure nurses have the resources and the support that they need to safely and successfully complete patient care to ensure the best patient outcomes that we possibly can. And due to the challenges of the pandemic, these nurse leaders had to adjust their leadership styles and adapt to the changing world around them. This study identifies the adjustments they made and provides useful educational information for future nurse leaders. The methods used for this research were simply using the Worcester State University Library search engine to search for articles with the following criteria. They had to be peer-reviewed articles published in an academic journal within the last 5 years. The study had to be performed in the United States, and it had to be published in English. And the key terms, I have a word splash, as you can see here. And as most word splashes go, the larger the word, the more it appeared in my research. So COVID-19, pandemic, nurse leaders, leadership, and nursing leadership were some of the words that appeared most in my research. And the words that are a little bit more difficult to see are patient advocacy and health policy there at the bottom, and nurses and advocacy in the blue towards the top. And those are some important topics I'm going to discuss a little bit later. For results, there were several common themes noted among the articles. The need for enhanced decision-making skills, increased interdisciplinary collaboration, and the importance of patient and staff advocacy by these nurse leaders were some of the main points. So an article interviewing enterosomal / wound, ostomy, and incontinence nurses, and an article defining the gaps in crisis preparedness plans, both discussed the importance of increased decision-making skills and advocacy in our nurse leaders. So the ETWOC study talked more about emotional intelligence relating to the pandemic and COVID, because during this time, during this crisis, it was very emotional, very stressful. And so these nurse leaders had to be more sensitive to their patients and staff. They had to have this emotional intelligence and be intuitive to make sure that we were being empathetic and compassionate during this time. And with advocacy, nurses are uniquely situated, again, especially in this crisis, to advocate for our patients. We see how health policy affects them firsthand. Nurses are on the front lines, as they called it, during the pandemic, and we see directly how health policy can affect these outcomes. And so nurses have an obligation to advocate for their patients in this way. Not only patients, but staff, and ensuring that our staff have the resources and that policies are in place to protect them as well. And another important finding was the increased burden on nurse leaders, and yet a shortage of self-care and a decrease in time for coping. Almost all articles that were selected for this study had an emphasis on team building and some sort of psychosocial support. In reference to team building and interdisciplinary collaboration, nurse leaders are the ones who have to establish this healthy work environment and have to establish these team building skills. Especially during this pandemic, when interdisciplinary collaboration had a huge increase due to things like proning teams and postmortem care teams and airway management teams. Team building really had to be increased and focused on, and these nurse leaders really put an emphasis on that. Self-care and psychosocial support was something else that was very important because these leaders had to carry a new burden. They had to carry this emotional and physical toll from working. A new kind of support, as this phenomenological study called it, because they had to be that calming voice for everyone. They had to constantly search for the right words for not only patients and their families, but for staff as well. And there was also this huge emphasis on self-care and making sure that these leaders have ample time to heal themselves after these long, difficult days of dealing with death and very sick patients. People need to cope and they need to have time to heal not only their physical body, but their mind as well. The limitations on this study include it being conducted in the United States because it only accounts for the experiences of COVID in the US. Therefore, further research is required to explain the experiences of nurse leaders from other parts of the world during this pandemic. Another limitation is the timing of these interviews. Some interviews were performed during the peaks of the pandemic, leading to some embellishments of stories. And other interviews were performed during the plateaus or, later in the pandemic entirely, when some of the aspects of the stories or experiences may have been forgotten. Moving on to the discussion, this study provided insight into the experiences of nurse leaders and them adjusting to the changes in healthcare during this pandemic. The main themes extracted from this data were an increase in team-based care, the importance of advocacy, and the need for self-care and coping time. The implications for this study, this information can be used in the future to both understand the qualities required of a nurse leader, but to also improve the current systems that are in place. Future nurses can take the information from these studies and get to really understand the qualities of a successful nurse leader, especially in the time of a crisis. And they can also use this information to, again, further advocate for patients and staff to increase preparedness and to have these increased support systems that are especially necessary in the time of a crisis.